I'm Noga Levner. I'm the co-founder and CEO of Picnic Health. And the company started here. This is a picture of my family, and this is my mom just before she was diagnosed with breast cancer. And as her caregiver, what I found was that I was essentially performing like a project management role, where it was my responsibility to kind of keep track of everything that was going on, make sure I understood it, and make sure all these medical records and information got moved around appropriately between her different doctors. And so I teamed up with this group of folks, including an engineer data scientist and physician, to build Picnic Health. And our goal was to just make it incredibly easy to take this whole burden off of the patient. And so when someone comes to our site as a patient or caregiver, they basically just have to list their providers, tell us who their doctors are, and then from there, we'll have them e-sign an authorization that lets us collect records on their behalf, and that's kind of where their job ends. Now, in the background, we're going and actually getting all of those records, and we have a 99% success rate collecting records if they still exist. So when the patient comes back to the site, like magic, they will see something that looks like this. It's a timeline of all of their care. And if you zoom in, you can see that an office visit, for example, there's a summary of important information that's surfaced. You can always click through and see the original record behind it. For lab tests, for example, you can see a nice graph of the most recent test, but then if you click through, you can see a graph of this particular lab aggregated across all of the different facilities where this test may have been done. And then last feature I want to point to is for imaging. Not only do you get the full report that the doctor has put together, but we actually have an in-browser DICOM viewer, so you're looking at an MRI or CT scan right in the browser. And we then make it super easy for our customer to go in and then just with 1 or 2 clicks tell us to request records on their behalf, update their timeline, or send records out to their doctors. We'll make sure that the records get there before the patient does so that the patient or caregiver just does not have to think about this. And that brings me to our business model. So we started with a B2C model where we're subscription-based, where patients pay us a monthly fee to manage their records for them. And you can see here most of our recommendations come directly through providers. We also, more recently, have an enterprise channel strategy where large groups of patients participating in clinical trials will get access to the service free of charge. And then finally, you can see some of our accomplishments. We've actually gotten records from over 3,500 facilities and closed our first enterprise partnership and raised our $2 million seed round.
Great, thank you.
Yeah.
So I have a question. After you get your just applause. Most of the time, patients don't want to bother creating comprehensive health records for themselves. They don't bother, they don't fill it out, they don't keep it updated. Why do you think this is a different time?
Yeah, well, so I think one of the things to note is that when I was testing the existing products that were out there, they just took so much work. So I think one of the reasons that this has been really hard to kind of like get patients to participate is because it's hard to get people to do things that are hard. And so our goal is essentially we just make it incredibly easy. We're kind of this like slick layer on top of something that's actually very messy. But I would say more than anything, we target patients with chronic conditions, which is, 1/3 of Americans, where frankly you just have kind of no choice but to deal with this. So for healthy folks, it's easier to ignore.
And then the day that comes, probably long after I'm dead, that the EMRs have to actually integrate and share data?
Yes.
Does that render you obsolete?
Well, we think there's going to be a lot of other interesting things to do, but I'm hoping that happens before I'm dead. And I might just be a couple years younger.
I think she just said I was old.
I'm older than I look. But interoperability will go a long way, but there's still going to be a role for patients to be moderating.
Fair enough.
Yeah.
Folks on the panel?
I guess part of the challenge with medical records, I definitely understand the trend towards the digitization and electronic records, but a lot of the more subtle points the doctor doesn't actually write down or just tells you during the doctor's visit. So how do you address that in trying to create complete records for a patient?
Yeah, I think the answer is that we don't address that right now. Like, we're trying to do this very, very simple, like something that should be very, very simple, but that doesn't exist right now, which is literally just getting this recorded data into the hands of the people that need it. And certainly in the future, I think it would be amazing to also have, a way to like record the doctor visit or have patients take notes or have doctors write additional notes. But just accomplishing this one task of like, making sure that what does get recorded gets to the right people at the right time is just a huge task and a huge advance in and of itself.
Stacey?
So I find it pretty powerful that you're capturing imaging data and labs data. And I'm just wondering how you're thinking about kind of downstream impact of being able to see outcomes in patient progress and making that data available on an anonymized basis for the benefit of other practitioners looking to stage and put patients on a course of treatment.
Yeah, I think that when we look at this, it's like as we grow, the opportunities to do interesting and really important things with the data are just endless. And so, obviously, we're super, super concerned with patient privacy and patients having control over their data, but on an anonymized basis, we certainly think that down the road, there will be really important opportunities for this very, very kind of granular, very detailed data on every patient across all their providers to serve a purpose like you're suggesting. Yeah.
Michael?
Question on scalability and how the sausage is actually made. There's a lot of people that ask providers for records, but it's not that easy. So how much calling or manual kind of swivel chair activity is going on between your team and the provider community? And how often are they sending you bad data, poor files, incomplete files, and all that kind of stuff?
Yeah, so it's amazing how much progress we've made just in the 18 months since we got started. At the beginning, I'm not going to lie, it was basically all very manual phone calls. We now have implemented we use technology where we can. So there's a task management system where like someone signs up, the fax request goes out automatically. If it doesn't come back in 24 hours, then a task pops up for someone to make that phone call. And then we record like what was the phone tree and like who was the person that answered and who was the person that answered later when then they actually sent the records. So we've just gotten very good and much more efficient. And so now we're at a rate where frankly most of the system can operate on its own and humans kind of have to jump in and fix those problem spots and keep increasing our efficiency over time.
Do you have to actually manually create the summaries for that front page?
The front page.
Excerpts from the reports you receive?
So the hard part is actually not getting the records. It's getting the data out of the documents and into a database where it can be displayed. And so that's where we use something called basically human-in-the-loop machine learning also, where you have humans that are initially going through all the documents and sort of actually doing that type of curation and digitizing things, and then that becomes training data for an algorithm that gets better and better over time at automating it.
Terrific.
Yeah.
Thanks.
Thank
Thanks
you.
very much.